Did you know that acupuncture can help with the rehabilitation process following a stroke? Now, the sooner that we can get the acupuncture done to when the stroke actually happened. Now, obviously, the first 48 hours of a stroke, you need to be seen in the hospital. They need to be dealing with anticoagulants and all of those different medications. That is a hospital aspect. However, as soon as possible that the Western medicine have introduce acupuncture. It will not cure the symptoms of the stroke and the complications of a stroke, but it will significantly increase your rehabilitation and the effects of the stroke on your long-term health. It can help with the paralysis, not just in the face, but also in the arm and the leg. It can help to re-establish some nerve sensation, which is vital. It can also help to reduce the amount of a bleed in the brain, but also if it's a clotting aspect, it can increase the blood flow within the body. We have found overall it helps with the muscle strength and it helps with the overall well-being of the patient, which is all vital in those critical rehabilitation months. So what happens if you had a stroke a couple of years ago and you're having difficulties? The damage is fixed and you have the paralysis, the nerve tingling and all the difficulties, the weakness, normally on one side. Can acupuncture still help you? And a lot of people go, well, great, yeah, I know that it can help me if I get it straight away, but this was a couple of years ago. There's nothing they can do. That's not true. Acupuncture has still been found to make a benefit on people even up to 20 years post-stroke. Now, it isn't suddenly going to take a fully paralysed limb and make it move, but it will ease the ache and improve the muscle strength. Now, to what extent, every single person is different. So I can't tell you it's going to be a miracle cure because it won't. It is used as part of a rehabilitation process. And what we find is that often when we're dealing with motor, there is also sensory, balance and reflex function, not just motor function. So you're thinking, I want my paralysed limb to move, but we've also got to deal with sensation, sensory, reflex, action. And we've got to deal with balance because there's other aspects in and other muscles being affected by the fact that one is now weak. And acupuncture helps to balance all of those too. And one of the things we use a lot in stroke rehabilitation is electroacupuncture. It's one of the strongest we use, or scalp acupuncture, as you can imagine, to treat the brain. Go and do some research on acupuncture with strokes. There is many different types of acupuncture and many different types of strokes. This has been Thoughts with Points, and I'm always happy to answer any questions. Take care.